Good afternoon. My name is Luis Martinez Alicea, Director of Government Affairs of the Puerto Rican Chamber of Commerce of Central Florida, and I'll be the moderator of the panel COVID-19 Impacts on the Puerto Rican Latino Community. The COVID-19 pandemic came into our community unexpectedly and changed the course of our lives. It has been a phenomenon that we did not expect and negatively impacted our residents, families, and businesses. As we mark 1 year since COVID-19 was declared a global pandemic, we reflect on how our community faced this challenge, how governments handled the health crisis, and which areas we need to improve to continue serving our growing Hispanic and Puerto Rican community in a fair, inclusive, and equitable way. Today, we have a panel of experts from the government, philanthropic, and healthcare sectors who will share with us their experiences facing the pandemic, discuss COVID-19 response in the state, and the inequities in the vaccine rollout plan, as well as provide recommendations on how we can work together to eradicate the spread of the virus. Our panelists are State Representative Carlos Guillermo Smith, Frankie Miranda, President and CEO of the Hispanic Federation, and Paul Velez, President of Puerto Rican Health Centers. Let's begin with our first panelist, Representative Carlos Guillermo Smith, who is not able to join us today due to a previously scheduled commitment, but he sent us a video about the priorities and the community efforts he has participated to help our community during these times of adversity. Let's see Representative Smith video.
Hola, buenos días. Soy Carlos Guillermo Smith, un representante
Thank you very much. Gracias, Representative Carlos Guillermo Smith, for your brief remarks. And now let's continue this discussion with Mr. Frankie Miranda, the President and CEO of the Hispanic Federation. Mr. Miranda, we have seen how the Hispanic Federation have working hard by being at the front and center of many natural disaster relief and community emergencies response. And more specifically, with the leadership of the Florida State Director, Velez. The Hispanic Federation has been everywhere, leading conversation, providing services, and developing programs to empower and advance the Latino community in the state of Florida. But Mr. Miranda, I have a question for you. Can you please tell us in detail the initiative that Hispanic Federation has led over the last year to help underserved communities impacted by COVID-19 pandemic? And please tell us what the Hispanic Federation has done on the national scale to address the COVID-19 vaccination and service inequities with the Puerto Rican population.
Well, thank you so much, Luis. It's been a while. We have not seen each other in person in a while, so hopefully we will be able to do that very soon. And thank you for having me giving me the opportunity to talk to all of you about what we have been able to do. For many of you that do not know about the Federation, for 30 years, the Hispanic Federation has centered our work in building capacity and power in Latino and immigrant communities, and in the nonprofits that serve our community. As a response to the challenges presented to us by the coronavirus pandemic, we created the most far-reaching Latino COVID-19 relief fund in the nation. We have been able to invest $16 million in partnering with nearly 300 nonprofit organizations in 30 states and in Puerto Rico to provide care and hope to severely impact families and communities. This is a model that we designed and we were able to put in place very quickly because of our experience in Puerto Rico after Hurricanes Irma and Maria. We also were able to invest in Puerto Rico, and thanks in great part with the great energy and help of the diaspora, Puerto Rican diaspora. We were able also to support organizations in Puerto Rico that were the first responders when the local government collapsed and the federal government was nowhere to be found. We always knew from the very beginning that these nonprofit organizations were going to be the first responders in communities, remote communities all across the island. And that is the same model that we use to make sure that organizations continue to provide services, have the emergency funds to continue to provide services during the pandemic. Our community-based organizations never closed their doors. They will continue to provide rental assistance, cash assistance, food assistance, so much that our community needed in a time of need. And that's how we focus our efforts to provide emergency assistance to these organizations. Also, we recently launched our Vida initiative to provide $1 million to low-income Latinos across the country struggling to find ways to get COVID-19 programs. And these specifically has been a program that we're working with our federally qualified health centers, las clínicas comunitarias. These are the ones that have been in the forefront and continue to provide services to the most vulnerable in our community. But they were able to receive the vaccine, but they have no other resources to do the outreach, to upgrade their spaces or hire vaccinators. And that has been our focus, making sure that those community clinics that are Latino-led, Latino-serving, have those emergency resources to provide better services. But our community has been devastated by COVID-19. The impact of the coronavirus on health, financial security, educational progress of Latino communities has been nothing short of devastating. And the impact is compounded by our way that the challenges that we have in distributing the vaccine and the testing. Latinos are disproportionately represented among the so-called essential workers in occupations with lower wages, non-existent benefits, and no job security. And Latinos are also overrepresented among the unemployed. So many times, essential can also feel like disposable. And also Latinos account for the largest share of the nation's undocumented immigrant population. And our communities are home to 1 million or millions who have spent the last 4 years in constant fear of separation. So for us, it is really, really important to follow the numbers. And we know that very recently, the CDC have reported that race and ethnicity is, of those that have reported, those states that are reported, we know that Latinos are behind the rates of vaccinations. And we need to make sure that we provide the resources and the information. There is so much that has been said about vaccine hesitancy in our community, but I truly believe that what we need is more accurate information and access to resources. I like to say that it is really important to have mega sites, but what Padre Jose and Carlos Guillermo Smith are doing on these pop-up sites in community is really the answer to the needs of our communities. We need to not use a one-size-fits-all to resolve this issue of vaccination and equity. We need to meet the needs. We need to provide information, bilingual information, by ambassadors and people that are culturally sensitive to the needs of our community. And I can tell you that we are going to be able to turn the tide around and make sure that our community gets vaccinated. But for that, aside from accessibility, what we always are advocating is to use fully the community-based organizations. We need to provide resources to our nonprofit organizations so they can actually be those providing the information, the outreach, and ultimately be those sites for the most needed in our community. We're not going to be doing any favors to any community and hard to reach communities if we don't do this multi-pronged approach. And this is the work that the Federation is advocating and doing across the country.
Definitely, Mr. Miranda. We have seen been witness of the remarkable job that Hispanic Federation has done through the years, not just in Central Florida, but in statewide, by providing bilingual and cultural competent services, not just to Puerto Ricans and Hispanic, but also to minority communities that are relocating to our state, our cities, our municipalities to pursue a better life for our families. So thank you for that. Mr. Paul Velez from Borinquen Health Centers. The question is, your organization has provided to the Hispanic Latino community many resources and services, and we would love to learn about what have been the challenges that your clinic has faced when it comes to serve minority communities.
Well, thank you, and please call me Paul. When I hear federally qualified health center, that's what we are.
Mr. Paul Velez, you there?
Yes. Yeah. I'm not on mute. Let me just make sure.
Yeah, we can hear you. We can hear you.
Okay. When I heard federally qualified health center a short while ago, that's who we are. In Puerto Rico, they're called 330, Programa de 330, porque in English they call them PHS, Title 330, Public Health Service. So, Borinquen, we began 49 years ago, as you said, where it comes to the work that we do.
I can't hear Mr. Velez.
Okay. I don't know why. Let me try click.
We hear you, Mr. Velez. Luis, if you want to just exit the room and re-enter while Mr. Velez continues to speak, we should troubleshoot any issues. Thank you.
Okay. If everyone can hear me, give me a thumbs up or go like this. Okay. Thank you. When I heard federally qualified health centers, that's what we are. That's what we do. And we've been doing this for 49 years. We're the oldest Puerto Rican founded organization in the Southeast United States, outside of Puerto Rico and also New York. But we began in what was primarily a Puerto Rican neighborhood called Wynwood. Obviously now Wynwood still has traces of Puerto Rican achievements, but our population is very diverse. 30 to 40% of our patients and clients are Haitian Americans. We have people from all over Latino America. We even have people from the Middle East, folks needing our help. Why? Because we have to deal with folks that are uninsured, underinsured, although we accept most insurances. But the challenges are such where getting people to understand correct factual information, There's a lot of misinformation going on in the Latino communities. And we're talking about folks that are highly educated all the way to people that simply, may not even have a high school education. Why do I say that? Because there's a lot of misinformation. As I can share with you, Borinquen, we're part of the federal rollout that began last week. We were one of 15 federally qualified health centers in Florida to begin the rollout. We have Moderna, and we have Johnson & Johnson, which is also known as Janssen. We had an event yesterday where we had Federica Wilson, who is our congresswoman that represents our district. We had the president of the NAACP, and we wanted to reach out and target children as well as their parents. So the challenge is right now is we got to go beyond 10%, 20%. We need to continue to do things, as I had written in an article the other day. We need to have public service announcements in English, in Spanish, in Creole, because that's not happening. We don't see those things happening on CNN and other leading whether it's CNN, Fox, whatever. We need to see companies to invest in public service announcements because people are scared. I can tell you, I'm fully vaccinated. I have over 150 of our staff out of 350 that are fully vaccinated. But again, Borinquen is continuing to do the work that we need to do best in the communities. And again, I would like to conclude that on NBC.com, there was an article that I contributed and it was quoted. It says, hard hit by COVID-19, Latinos bear mental health burden 8 months into the pandemic. It said 8 months because it was November 20th. But we still have to deal with anguish, anxiety, suicides that are significantly higher in the Latino community. So our quest is to continue to educate the populace and be able to reach out and to help everyone who wants a vaccine. We operate differently because we're not a state-operated agency. We're a 501c3, and we're very proud of the fact that Borinquen is continuing to be able to, as I said earlier, to do the great work that we do. Thank you.
Thank you, Paul. You just mentioned that language play a critical role for any minority communities that are establishing in the state or any state in the United States. Right. And I would like to ask to Frankie, from your point of view, what's the role language access plays in our community to ensure immigrant populations receive accurate information about the constant changes in eligibility to residents to get vaccinated?
Luis, I think that is extremely important, and I echo everything that Paul have mentioned, because it is critically important that we have this conversation with our community in a very, from not only in Spanish or in proper that have provided services on a constant basis, bicultural, bilingual services. Those are the real ambassadors that are going to be most effective in our community. There is, unfortunately, in our community, there has been a toxic narrative around our communities for a long time. We know that people are distrustful of government. People have been feeling that if they access a place that is staffed by the National Guard or people in uniform, they're going to feel that they're going to affect their status. They could if they are undocumented, or those mixed status homes are also going to be fearful to try to access any government services because of the threat that public charge was going to be used against them. There has been confusion about the census rollout. There has been confusion about the transparency of the elections. And there has been a lot of narrative that has been affecting our community. And at the end of the day, I feel that, as Paul mentioned, when you enroll and provide the right resources of not only the vaccine, but the resources to those that are in community that are aware of these concerns, and we will be able to have a more effective dialogue. If you add a coalition of organizations, of like all the organizations partnering here today, these are the people that can make a difference, but we need to be coordinated, and also government needs to tap into these great resource of the community-based organizations and the clinics in order to be able to change the trend. Less than 9% of Latinos have been vaccinated in the latest figures from the CDC across the country. This cannot continue to be like that, but we need to recruit those that can actually do the messaging, and also avoid that this vacuum of culturally sensitive information is taken by advantage by people that wants to commit fraud in our community, that wants to target our community. And we also, unfortunately, have seen unscrupulous people that have been targeting our seniors and many people that are desperate to get the vaccine.
Thank you, Frankie. Mr. Paul, we live in a diverse community with residents from different cultural backgrounds, ethnicities, disabilities, walks of life, and a large LGBTQ plus community. What are the next steps in combating the health and economic disparities in our communities? And how nonprofit organizations can leverage their collective power in addressing these issues?
Borinquen is a 501c3 registered with sunbiz.org. The role of nonprofits is significant. We haven't tapped really the 90%, the impact that we have. I'm very impressed and very proud that the Hispanic Federation has been doing an outstanding job for a number of years. And now we're getting the attention across the country, including Puerto Rico and also countries outside of Latino America, and that's very important. The problem is that nonprofits are having to deal with the challenges of being able to reapply for their grant funding. There's a lot of challenges where it comes to having to have various grants. Our base grant is from HRSA, from the Bureau of Primary Care. But then you have other, in total, we have like maybe over 34 grants. But in order for us to be able to deal with these challenges, we need to have the state, the federal government working together in harmony. And I know that right now we're on that path, but we still need to be able to put aside partisan politics. We got to work the aisles. We got to be able to work together as one. Eso es lo más importante, because you see, our logo for 49 years has been La Salud del Pueblo es la máxima ley. And in English, it means the health of one's nation is the ultimate law. So again, in order for us to be able to deal with these challenges, we need to be able to work together as one, work where we're not enemies with each other. Why? Because for the past 4 years, it has been very, very confusing, not only for our country, but around the world, including Puerto Rico, having to deal with the myriad of changes that are happening where it comes to funding, where it comes to the programs, especially in Puerto Rico, because the funding in Puerto Rico is like block grants. They don't get the fair share of reimbursement rates in Medicaid and Medicare, and that's really unfortunate. And I think that we need to be able, again, to come together and to urge, both of the party aisles in Congress and in the Senate to work together to be able to provide a strategic plan for Puerto Rico. That is significant, and it hasn't happened. We need to see these significant changes, because yo soy Boricua 1,000%, and I want to make sure that we can be able to overcome all these missteps that have happened over the years regarding Puerto Rico. Oh, now I can't.
Any comment, Frankie?
I think that Paul is, we are like in sync here, because it is important that we continue to work together. And there has been a conversation about the issues of distribution and accessibility, that there's not enough vaccines. I think that right now is the time to invest in all of these resources and to really investing in community-based organizations and the community health clinics. So when the vaccine amount of vaccine is no longer an issue, that we are ready to take in all of the people that would like to take the vaccine hopefully, as the president had mentioned, by May 1, that is going to be all the restrictions. Whoever wants to get a vaccine can get a vaccine by May 1. But in the meantime, there's a lot of work that we need to do, and we need to start building now. And I also am looking at some of the comments in the comment section, and it's like absolutely true. We need to really acknowledge the disparities that have been affecting our community. And I'm talking about health disparities, economic disparities, disparities in education, in housing. We need to acknowledge them in order for us to recover better. We cannot just recover and go back to what it used to be. I like to use this image that all Puerto Ricans can understand. When Hurricane Maria passed through Puerto Rico, the luscious green of the island was taken away. It was incredible to see how all the trees were like, all the leaves were gone, all the green was gone. And then suddenly people were so shocked to see the extreme poverty that existed in Puerto Rico. And people were saying, like, where is this coming from? It was always there, but it was covered by the luscious green of our tropical paradise. That's what COVID-19 did in our community. It pulled away the curtain and forced everybody to look straight in the eye, all of the challenges that we had in our community. But in order to be able to recover better, we need to join forces. We need to have these dialogue. We need to organize. We need to advocate, and we need to talk to our elected officials. So make sure that we have better coordination and our community understand that they can recover better.
Thank you, Frankie. Well, thank you all the panelists for sharing with our audience this important information. We are hopeful for an optimistic future in which we can normally resume our lives, but with a new awareness that values life as the most precious thing that we have, and the importance of maintaining optimal health. Likewise, the pandemic has taught us that having emergency health measures is critical when healthcare crises arise. And last but not least, never forget about our marginalized and minority communities that are the most affected communities during pandemics and difficult times. In this way, we can overcome the barrier. Gracias por su participación.
Come back. There you go. Thank you, Luis. And thank you to every panelist that had joined us today for this relevant conversation that is affecting right now our community, not only the Puerto Rican, but everyone who lives in this world and is facing the challenges of this pandemic. Thank you for your expertise. And thank you for leading this conversation. And we see the chat on fire. We see the comments. Thank you so much for everyone who is attending with us throughout the day. And we have 2 more segments that are very crucial to the end of this program. For that, we encourage you to follow us on the social media platform of the Hispanic Federation. You will be able to see all the representatives and legislator messages. They are there uploaded for you to review. But before, you have to go to the main page and then click on the next panel. And for the next panel, we have Melissa Marantes. She's an attorney, the executive director, and co-founder of the Orlando Center for Justice. She will join us and we'll discuss legislative bills regarding the immigration that have been filled this session and why the Puerto Rican community needs to pay close attention to the impact they have on all communities. That is next. How immigrants' bills affect our community. We hope you enjoy.